COVID-19 trends. Dr. Jeff Duchin is here to provide an update and also answer questions from the media. So Dr. Duchin will have a few minutes to share some more words with you all, and then we'll take questions from the media. Members of the media, please use the raise your hand function. If you have a question, we'll call on you after Dr. Duchin's remarks. And I'd like to ask if you can limit your questions to one to start so we can get through several questions. We'd really appreciate that. With that, I'll turn it over to Dr. Duchin.
Thanks, Sharon, and thanks everyone for joining. Can you hear me okay? Great. So here, I'll start with a brief update and a few thoughts, and then I'll take your questions. So currently in King County, we are averaging 171 cases a day. This is compared to approximately 40 cases a day early in June. Last week, we saw over 1,000 cases. And as you know, the reported cases don't reflect all the cases that are happening in the community. The actual number is higher. It's estimated to be up to 10 times higher. The majority of cases are still in the 20 to 39-year-old age range, but the number of cases among people in their 40s and 50s and all age ranges is increasing gradually. And that's since mid-June. The median age of our cases has increased from 26 in early June to 36 currently. And as we've talked about previously, younger people with COVID-19 are less likely to require hospital care, and our hospitalizations have increased only slightly since mid-June and remain stable and low, with plenty of hospital capacity. So in mid-June, we had about 60 hospitalized COVID patients in King County healthcare facilities, and now the number is hovering in the 80s. But that still represents only about 2% of all hospital beds being occupied by COVID-19 cases. And we know that infections can spread from this predominantly younger group to older community members and to people with underlying health conditions who are at increased risk for severe disease requiring hospitalization. And for this reason, we continue to closely track the healthcare system status. This recent surge in cases continues to threaten the health of our community and the health of our economy. And we all need to reboot our attitude about this disease and our resolve to take the necessary steps to live with it safely. Our challenge, again, is a long-term one, to manage COVID-19 in that zone between total shutdown and letting the virus run wild. So we need to make long-term fundamental changes in how we go about our lives. And if you are thinking COVID is over and the risk is lower, you need to rethink your plans and your activities. Regardless of our age and personal health status, we are highly interdependent and interconnected. Our success moving forward as a community depends on the ability of every sector of our society to decrease COVID-19 transmission. And we will continue to depend on one another to do everything we can to stop the spread of COVID-19 in every area of our lives in order for all of us to be able to get back to what we want to do and what we need to do as a community as safely as possible. And again, this means we need to limit our activities, limit the number of activities, the duration of activities, and the proximity of our close contacts with others. We need to avoid group gatherings, wear a mask whenever in public, and wash and sanitize our hands frequently. If we do these simple things, if we do them compulsively and conscientiously, we can, again, reduce the number of cases in our community to a level that will allow us to do more safely and have more of the activities that all of us want to get back to sooner. We also want to pay attention to improving indoor ventilation and remembering that outdoors is a much lower risk setting than indoors for transmission of COVID. And remember, just because you can do something doesn't mean you should do it. So with that, I will stop my prepared comments and welcome questions.
Thank you very much, Dr. Duchin. So we'll start with questions. If you have one, again, just to remind you all to raise your hand, and we'll start with Nick Popham. Please also announce your news agency. Go ahead, Nick.
Sure. Before, by the way, do we anticipate the transmission rate to go even higher than where it is now? And if you could, if you could for me, where is the transmission rate?
So we've been seeing an increase in our daily and weekly cases now since beginning around after the Memorial Day holiday. It's very difficult to predict, what is going to happen in the future, because the cases we see today reflect the behaviors that people were having about 2 weeks ago. And we don't have a great way to know with precision what things people are doing, how close they're having, how much close contact they're having with others, how much activity until 2 weeks after it happens. So I'm hoping that if people are taking this increase seriously and understanding the threat that it poses to our ability to do the things we need to do to get our economy back, to get our kids back in school, and to do the things that all of us want to do socially and recreationally as safely as possible, that behaviors will change. And if behaviors change, the cases will come down. If behaviors don't change, we would expect the cases to continue to rise, and additional measures may have to be put in place to limit the ability of people to have so many close contacts so freely. But I can't tell you, I can't predict for you where we're going to be next week. I'm each week hoping that we'll see a plateau and then a decrease, which will indicate to us that people are improving their COVID-19 prevention behaviors.
Thank you. Question from Glenn Farley. Go ahead, Glenn.
Unmute myself. So using some of the benchmark numbers, what's your 14-day moving average of new cases now versus the low point versus early April, if you can recall that?
Well, I can give you two of those points off the top of my head. We're using a 7-day average of cases, and we're now averaging 171 cases a day over the last 7 days, compared with 40 per day in early June, which was 36 was our nadir for one day. But we were seeing for multiple days there in early June about 40 per day, and that was at our pretty close to our target of 25 per 100,000 over that 14-day period. But since then, the cases have risen. I believe that back in April, we were seeing close to 200 a day at our peak, 190 something. So we're close to our peak in April. Now, of course, the demographics are different. Back in April, our outbreak was driven largely by cases in long-term care facilities. So those were older individuals, and those resulted in hospitalizations at a much higher rate than our current cases, because the age demographics have flipped, and now we're seeing more cases in the younger age ranges and fewer in the older. But over time, that may change, and that's one of our concerns about having so many cases in the community. We really need to drive down that number of cases in younger people.
Kate Walters, go ahead.
Hi, Dr. Duchin. We've been sort of taking this in pretty small chunks, 2 weeks to a month at a time. Obviously, a very new virus still, and so there's still a lot to learn. But as you start talking about longer term changes, how do you want people to kind of be switching their mindset in terms of just living daily life, what that feels like and looks like when we don't really know what the end date is for this, and we're no longer kind of looking at it in just those 2 week chunks?
Yeah, thanks, Kate. So this is a new virus that really we didn't recognize just a couple of months ago. So we're constantly learning more, and it's difficult to predict exactly what will happen, but we learned a lot about transmission over the last few months, and we've learned a lot about how easily this virus can spread globally, and it's unlikely that this virus is going to go away at any point. So it's becoming established in the human population, and what that means is we need to learn how to live with it. And the extent to which it disrupts our lives and causes serious illness may change over time. I hope it will, and I anticipate it will. But we need to understand that for the first year, most likely, and maybe two, this virus is going to cause significant amount of illness, and it's going to be a challenge for us. And so we will need to adjust our behaviors unless we have a very effective vaccine widely available. We'll need to adjust our behaviors to decrease our risk in all aspects of our lives. And the thing that we know with most certainty about this virus and how to control it is how it spreads from person to person. And we can effectively interrupt that spread by limiting our activities to one another. And we saw that demonstrated locally and in other communities that had stay-at-home orders when the levels of COVID-19 cases dropped dramatically and proportionally to the extent that we separated ourselves from one another. And so the key fundamental lifestyle change that we're going to need to make for the coming months, or maybe longer, maybe even a year or so, is to decrease the number of interactions we have, close contacts with one another in the community, limit our activities, and take precautions, including mask use and frequent hand washing, change the environment in which we work and carry out our activities to decrease the risk of COVID by doing things like increasing ventilation, keeping people farther apart from one another, limiting the duration of contacts and activities. For particularly for our older adults and community members who have underlying health conditions, these precautions will be especially important. And this is going to be a significant challenge for all of us, both on the personal level and on the institutional level, because this is stressful, having to change our lifestyles in such a way, so dramatically. But it's necessary in order to keep as many of us healthy for as long as possible until we have either better antiviral drugs or a safe and effective vaccine that is widely available that can decrease the risk. So when I talk about long-term changes, I'm talking about fundamentally rethinking the way we live our daily lives and go about our work and our recreation and social activities, so that everything we do is done in a way that acknowledges and understands the risk for COVID-19 transmission in every setting and takes steps to decrease that risk in every setting.
Thank you. Steve Kiggins, go ahead.
Hello, Dr. Duchin. Thanks so much for taking my question. It's a twofer. If you can explain what you think you saw happen in Yakima County and the success in using some of the face coverings there, what you've learned there, how that might apply to King County, and then what health officials like yourself are looking at internationally to learn what you could take from there to learn here, if that's even applicable.
Okay, thanks, Steve. With respect to Yakima County, I should say I have not been closely involved in that outbreak. I know a little bit, and I know that the health officials in Yakima and its Washington State Department of Health have indicated that the social distancing measures and the mask use in that county, they believe, have made a significant positive impact on the outbreak, and the numbers of cases have dropped, the transmission rates have dropped significantly, which is exactly what we would expect, because we know that if people are staying farther apart from one another and wearing masks when in public, the risk of transmitting the virus goes down. And so the lesson for us is that we can do the same. We have very vigorously relaxed our understanding and our attitude about COVID-19 in King County. People are doing a lot of socializing. They're planning parties, vacations, get-togethers. You can see on the weekends there are many people gathering in close proximity outdoors. We know that there are people doing a lot of things indoors as well, and visiting and so on. And each of these activities contributes to COVID transmission. And it's really critical, again, to remember that this virus transmits from people before they know they're ill. You cannot avoid this virus, and we cannot adequately protect ourselves simply by staying away from ill people and having ill people isolate themselves. It's critical that ill people isolate themselves, and particularly as early as possible when their symptoms develop, to prevent transmission. But many people who are infected have no idea. They don't feel ill until several days after they're already spreading that virus. And that's what we all have to understand, is those friends and family members and colleagues that were around every day who look well may be infected. They may be breathing out of virus particles into the environment that we will be exposed to. And that's why keeping our distance and wearing those masks at all times, even when people appear well in our social circles, is so important. So the lesson from Yakima is that social distancing, physical distancing, mask use are very effective strategies in decreasing transmission, and we should learn from their success and repeat the success that we had earlier on by remembering that COVID-19 is still with us. It's not going away, and the risk remains as high as ever. So we need to remain as vigilant as ever and as conscientious as ever about using our COVID-19 prevention measures. With respect to international, we try and keep up as much as we can with the literature that's, tsunami and of literature that's coming from all over the world and from our own researchers here in the US. There are lots of lessons, again, that reinforce the success of community solidarity and community action and protecting one another from all around Europe in particular, and in Asia. We've seen that those communities that have heeded the guidance to decrease their activities and interactions, and particularly elsewhere in the world, the use of face masks by most of the public have led them to control the virus to an extent that allows them to continue to function in their societies without excessive risk. And I think we can get there here in the US as well if we remember how the virus spreads, if we remember that it's important to take basic precautions to decrease the risk not only to ourselves but our community members. So stay apart from one another, wear masks whenever in public, good hand hygiene, ventilation, and also that what we do as individuals has a tremendous impact on everyone else in the community, so that we have a tremendous interrelatedness, what we do as individuals, as workplaces, as employers, and operators of recreational venues is critical. And we're so interrelated and so codependent on one another to take the right steps, that we have an obligation to one another as a community. If you're young and healthy, you may think, I'm at low risk, it's not a big deal. But even if you yourself do not require hospital attention or get extremely ill, you can spread that infection just as effectively or more effectively than many other people in the community to those that are at risk. And that may include older adults, or people have underlying health conditions, people in your home or in your social circle. So even those who aren't personally affected need to understand that they are a big part of our community with respect to transmission, and that what they do has a tremendous impact on what happens to the rest of us.
And Dr. Duchin, because we're getting a question in from the public that really relates to what you're talking about, I just want to follow up, and then we'll get back to Allison Grande next. There's a question here that's related to what you're talking about, and I'll just read it here for you. It said the initial goal that was trumpeted was flatten the curve. So I'm assuming that means thinking about deaths and hospitalizations being controlled. And so the question was really looking at the numbers now. Why are we now focused so much on case numbers and this change? Are we suddenly focusing on those numbers and trying to control those rather than the initial goal, which was really about controlling deaths and hospitalizations so we don't overwhelm the healthcare system?
Okay, great. So the curve that was being flattened and the curve that we still need to flatten is the curve of new cases occurring. And the ultimate reason we do that is to prevent severe illnesses, hospitalizations, and deaths. So the goal hasn't changed. What's changed is that early on in our outbreak, it was centered in long-term care facilities where there are more vulnerable adults, and many of the cases were in middle-aged and older adults. And so we saw a much more quick and vigorous impact on our healthcare system. Currently, there's been a lot of steps taken to reduce the risk in those settings, and at the same time, there's been a lot more activity among our younger age group that is leading to more transmission in the younger ages. And though the younger age group does not have as many serious health outcomes, although they can have many serious, young people can get very seriously, they'll have life-threatening illness, and there are deaths as well. But the risk is much lower than it is in older adults. And so the reason we're interested in so-called flattening the curve and decreasing the risk of transmission in the younger folks as well, is because we believe that ultimately those cases will lead to transmission in the older age groups. The more disease we have in the community, the more likely it is that older adults and vulnerable people will become infected. However, your point is very good, and that is, to the extent that we can manage our cases without having large numbers of hospitalizations and large numbers of deaths, that should be the goal. And so this gets back to Kate Walter's question about, can we predict the future? We're learning every day, and we only learn from experience what volume of cases we can manage and avoid that adverse health impact with hospitalizations and deaths. And so if we find that we can tolerate a certain level of cases and not have excessive hospitalizations, not have excessive numbers of deaths, that will be very good for us. But as we've seen in many other communities around the country, their large outbreaks have started with increases in younger people that have then become generalized throughout the community, and their hospitals and their ICUs are overflowing and are very stressed. And so I don't have a reason to believe that our community is fundamentally different in any way. And therefore, I think we have a strong motivation to try and decrease the number of cases that we're currently experiencing to avoid that those secondary and tertiary effects that will generate hospitalizations and deaths. But ultimately, ultimately, we all need to understand that there is not ever going to be a no-risk scenario, that COVID will be out there, that people will most likely always become infected to some degree, but hopefully at some point, the disease will come into an equilibrium where we have enough control measures in place, either through the way we limit our interactions and our mask use, and more optimistically through the vaccine or good antiviral drugs, that will allow us to get back to our pre-COVID lifestyles. And at this point, we really can't predict where this outbreak is headed from 1 week to the next very accurately. We can only predict very short term. And so the reason we're trying to suppress the curve again is because we anticipate that, based on the experience elsewhere, that the current increase in younger people will ultimately lead to an increase in hospitalizations among older and more vulnerable people. That was very long-winded, sorry.
Thank you. Lots of really important and somewhat nuanced information. So thank you. Go ahead, Allison Grande.
Hi, Dr. Duchin. Thank you for your time. I wanted to ask the situation going on now with nursing homes and how that's looking in King County. Because a lawsuit was filed, we've been made aware of a number of cases that happened at this Renton Nursing and Rehabilitation Center with 47 employees and 52 patients. How is it looking in that community as far as how it's being handled?
In general, we've made a lot of progress as a community. The long-term care facility community, I think, is in much better shape right now than it was when this outbreak emerged unanticipatedly. So many of our facilities have significantly increased their knowledge and infection control practices around COVID-19. There's more testing being done. Many of them are routinely screening their staff. We're finding that facilities are reporting cases, smaller numbers of cases than they had previously when they detect COVID. So we're getting basically reports earlier, and this is apparently allowing them to limit the transmission. We haven't had many large facility outbreaks compared to what we had. I shouldn't say large. We haven't had many outbreaks with large numbers of cases in long-term care facilities, such as we had earlier in the outbreak. So, of course, all of this is in the context of relatively low level of community transmission in May and early June, and this shift to younger people. But I think that they remain a highly vulnerable community because healthcare workers, circulate not only in the long-term care facility when they're working, but they're out in the community. They have families, they have to shop, they use public transportation. And so the risks to people, healthcare workers and staff in long-term care facilities will be omnipresent. And the higher levels of disease we have in the community, the more likely that people who work in those facilities will become infected. And so that is very worrisome to me, particularly thinking about rising rates and going into the fall when we may see compounded effects from influenza and the potential for COVID-19 transmission to increase dramatically as people come more indoors and the weather changes. So in summary, I can say that we're seeing fewer large outbreaks. We're seeing more evidence of testing and more frequent testing, which is excellent, and more evidence of better infection control precautions being taken in our long-term care facility community.
Thank you. And we have another question here from the community asking about the severity of the illness. Are you seeing indications that the severity of illness may be decreasing? They're referring to several studies coming out about the topic, and if we've seen anything locally.
No, locally, we have not. Although, we don't, as a public health agency, we don't have clinical studies in progress here. And the types of studies that I think the questioner may be referring to are probably done by either public health or clinical facilities together to look at, very carefully the course of illness, the spectrum of illness, and the extent of disease. We are aware that there are some advances that are being made in how to treat people more successfully, so that fewer people are being put on ventilators. There are a few drugs that have been shown to be effective in treating severely ill people. So all of those are good news, and we're hoping to see more therapeutic advances as well that will decrease the morbidity and mortality from this disease. But as far as the overall spectrum of illness changing, I haven't seen any evidence that is actually happening. There was a study that I saw yesterday that suggested that mask use not only decreased transmission, but also decreased the likelihood that the person who wore the mask would get severely ill. And that study suggested that by filtering out some of the virus, that if you become infected and you're wearing a mask, you get a lower dose, basically. And there is a significant number of medical professionals who feel that the infectious dose or the inoculum is an important factor in determining the severity of illness. So to the extent that people wear masks, if that report is correct, they would not only be reducing the risk of spreading COVID-19 to others, but also reducing the risk to themselves should they be exposed to COVID-19. But I haven't seen any population health data, that would support that at this point. It's more of a theoretical consideration based on what we know about other viruses and the dose that people get exposed to and the severity of the illness in response to that dose.
Thank you. And we'll try and go back and get to a few of these follow-up questions from media. Glenn Farley, you are unmuted for your follow-up. Not sure, Glenn, if you're able to ask a question. Okay, we'll come back to Glenn. Kate Walters, it sounds like you had a follow-up. You can go ahead.
Yes, thank you. Dr. Duchin, I just want to double check my understanding of the numbers you cited earlier to make sure that I have that correct. It sounds like you're saying that the 7-day average of cases has more than quadrupled since early June. And if that is the case, just wanted to get your take on sort of your thoughts on things like restaurants and bars still being able to serve, even if the majority of it is outside over these summer months, if those cases have sort of gone up that rapidly in the past little bit.
Yeah, so Kate, your understanding is correct. We went from about 40 cases a day ballpark in early June to now averaging about 171 cases a day over the last 7 days. And again, throughout this time, we've seen minimal, some impact, but minimal impact on our hospital capacity, and our healthcare system remains in very good shape, and they're able to care for people with COVID-19 as well as any other health needs right now, and that's the way we want to keep it. The issue around restaurants and other activities is important, and that's one reason the governor increased restrictions incrementally again yesterday. It's very, again, we really want voluntary behavior change. It's the last resort always for public health to require people or prohibit people from doing things, but we want them to use good judgment and decrease the number of activities they're doing, which would include restaurant visiting and other social interactions, and to do those activities more safely. And we're hoping that with continued education and communication to the public about the importance of rebooting their attitude and their conscientious behaviors to limit COVID-19 transmission, that we'll see some decrease in that level of transmission. We also, again, acknowledge that the bottom line here is severe illness, preventing severe illness and death. And we, again, there's so much that's unknown that we can't predict. We anticipate that these high case numbers are going to ultimately lead to increased hospitalizations and deaths. And that's why we're doing not only the messaging, but further restricting some of the activities that are currently allowed. But over time, if we see that we're having high levels of cases, but not seeing the impact on the healthcare system and severe illnesses and deaths, that may tell us that we can relax our interpretation a little bit, and we can tolerate a higher number of illnesses in the community. This is one of the things that we're learning by trial and error every day. How much illness can we tolerate in the community without compromising our healthcare system, without causing an unacceptable number of hospitalizations and deaths? The bottom line is we really need to keep our healthcare system functional so it can take care of not only COVID patients, but every other patient that needs to be seen for medical care, for a chronic illness, for a cardiac event like a heart attack or a stroke, a car accident, anything. So that's really the most important outcome that we're really trying to protect here. We understand that this virus is going to be present for years and years, and people will become infected. We're not going to be able to prevent all infections. And what we're trying to do is understand what's the balance. What is the sweet spot that reflects the number of cases that can safely occur in a community without overwhelming the healthcare system and causing undue morbidity and mortality. Based on what we know from what we're seeing in other communities, we feel that the current levels are worrisome and very concerning and will lead to increased hospitalizations. But we don't know that with certainty. And that's why we're watching every day and not closing everything down right now. But if we do see that impact on the healthcare system, where they're being overwhelmed with patients, or ideally before that happens, rising numbers of patients with increased levels of severe illness that threatens the healthcare system's ability to care for everyone in the community. And we would need to take more rigorous measures to restrict activities. But this is one of the things that we just can't predict and have to take on a day-to-day basis to know with certainty.
Thank you, Dr. Duchin. And we are about at time here. So if you, I know there were a few follow-up questions, so you can email phpio@kingcounty.gov for media for any follow-ups. I did want to, just before we close, Dr. Duchin, follow up with one quick question and then any final messages. I know in the past you've talked about where we're seeing most spread, particularly through our contact tracing efforts, and I'm assuming that we're continuing to see a lot of household-related spread, as well as what you're characterizing as general community spread. Is there anything that has changed about that recently? And then any final wrap-up comments?
Thanks, Sharon. No, the majority, the major risk factors that we're finding are household transmission and community spread. Community spread both through social activities, gatherings, family events, travel, and workplace related as well. So basically just people doing too much in too close proximity without taking precautions, and not enough mask use, hanging out for too long, in close contact with others, and seeing too many other people, and just doing too much for the time being. Those remain the key drivers of transmission that we can see. There's not any one sector or one activity that we can say is driving this. There's just a whole lot of activity in general that's happening that's not being done safely enough. With respect to parting words, I would just encourage everyone to remember that COVID-19 remains a very significant threat to our community health, to our ability to get back to economic health, and to get our kids back in school, to do all the things that we want to do. And the actions of each and every one of us will determine how successful we'll be as a community in being able to operate not only in the next couple of weeks, but over the next couple of months and perhaps years. So we need to fundamentally rethink the way we go about our lives, the way our environments are structured, to decrease the risk of COVID, and to reset our expectations about when we might get back to our pre-COVID lifestyles. It's not going to happen in the near future, and we need to come to terms with that and think through how we can, as individuals, as families, as businesses, and as community members, interact as safely as possible and respect one another by all of us taking the prevention measures very seriously, because the alternative will ultimately be increasing numbers of serious illnesses for some of our most vulnerable community members, but also a number of bad outcomes will inevitably occur even among younger, healthy people.
Thank you very much, Dr. Duchin, for your time today. I know you're managing an entire pandemic here, so we so appreciate you taking to speak with the media, the public, and thank you all for your continued coverage of this important issue. I know we're going into a warm weekend, so we appreciate all the messaging that the media is getting out to emphasize the public to really limit the number of close contacts they can have and continue to work collectively on this. So with that, thank you all again for your participation.
Thanks, Sharon. Thanks, everyone.